Hello, everyone. Welcome to the CMS Hiring New in 2022 webinar series. We will get started within the next minute. Thank you so much for joining us. All right. Well, thank you everyone for joining us today. Our participants are rising above 100. We really appreciate you taking the time to be with us. So welcome again to our Hiring New in 2022 webinar series. We're back at it again every first and third Wednesdays at 1 o'clock. And happy Pride Month. Thank you for joining us today. We have over 502 registrants for today's webinar. So give yourself a pat on the back, as I mentioned before, for investing in the future of your career and taking action towards learning more about federal hiring and CMS, ultimately CMS. So my name is Heather Campbell, and I'm a recruiter with the Centers for Medicare and Medicaid Services. I serve because I am passionate about helping job seekers connect with their dream careers at the Centers for Medicare and Medicaid Services. This webinar today is a little different than we typically do. Typically, we have a very heavy federal hiring webinar scheduled for you to talk about hiring topics, but today's topic is a little different. It is all about CMS Culture Defined. So today you're going to hear firsthand accounts of what it's like to work from the CMS, for CMS from the culture perspective. So today we are joined by members from some of our CMS Employee Resources group, including our Asian American, Native Hawaiian, and Pacific Islander group, Employee Resource Group, our Disability Employee Resource Group, and our Pride Employee Resource Group. This webinar will be recorded and posted to YouTube, and my colleague will post the link in the chat. But today's topic will likely not be available until next month, a month after today's event. We have two ASL interpreters on the line, so please pin their videos if you need it. A follow-up email will be sent to all of our registered participants with slides, and questions will be received in our Q&A box. So we have some of our staff from our Office of Human Capital Recruitment and Outreach team ready to answer your questions in the chat box regarding content we are covering or questions for our guest speakers today. So let's jump right into today's agenda, starting with just a brief overview of how we define CMS and just kind of what CMS is culture defined at how we define culture at CMS. So company culture is a business attitude, values, behaviors, and goals from entry-level workers to executive management. And a company's culture defines the way people interact with each other and the way companies make decisions. Culture can affect how many tasks you complete in a workday, how often your company holds meetings, and how open management is to discuss new ideas. Company culture refers to the attitudes and behaviors of a company and its employees. It is evident in the way an organization's people interact with each other, the values they hold, and the decisions that they make. A company's culture may be expressly and deliberately cultivated, or it may simply result from the accumulation of decisions made over time. With a strong company culture, employees understand the expected outcomes and behaviors and act accordingly. While the agency, CMS, has its general culture, what you're going to hear today are views from different employees at the agency. And there could be differences from department to department or office to center, which affects someone's personal point of view. So let's jump right into our panelists that we have on the line for today's webinar, CMS Culture Defined. So we're just going to do a really informal panel today. We have three panelists today who I'm going to go ahead and allow introduce themselves when they speak. And we have really 7 cultivated cultural questions that we have for them today to answer about their experiences in their respective offices or centers within the agency. So thank you, Haley, Carly, and Julia for joining us today. So my first question to my panel and panelists, please do when you speak first, you can go ahead and introduce yourself. So first, we'll start with Haley. How would you describe the work environment?
Hi, Heather. Thank you so much. And I want to give a warm welcome to everyone who's joined us on the call. We are so excited that you could join us, and we're happy to provide a little bit of insight into CMS culture-wise. So where I'm at, I'm within the Office of Human Capital. We're under operations within CMS in the Division of Wellness and Engagement. And so from that perspective, there's a huge focus on team collaboration, working together to realize a goal or to improve a program. I feel fully supported by my teammates, and I feel that I can make constructive contributions as well. In addition, it is incredibly inclusive. It encourages contributions from individuals of many different backgrounds, as you can tell, all three of us from a different ERG. So I'm an employee in the resource group called CMS Pride for LGBTQ individuals and allies. And I've not been part of a work environment before that not only encourages diversity, but embraces it. I can bring my full self to the table and use that as an asset to my professional development, as opposed to it being perhaps a hindrance. And we have, I believe, 8 different ERGs at CMS, including those that represent African Americans, Asian American, and Pacific Islanders, those with disabilities. There's a women's ERG, Latina, Hispanic Heritage, LGBTQ Pride, and the Veterans Assistance Committee. And I'm also part of CMS's efforts to promote diversity, equity, and inclusion through the agency. We hold DEI classes and have a DEI ambassador program as well for liaisons between components.
Thank you so much, Haley, for giving us some insight on. We both work in the Office of Human Capital on exactly the type of services that your organization really provides to the internal client, which are the CMS employees. So that was great. Carly and Julia, you can take it away. How would you describe the CMS working environment?
I can go. Just to introduce myself, my name is Carly Madash. I'll do a quick description. I'm a white woman with short reddish brown hair. I'm wearing a brightly patterned blouse. It has, I think, birds on it. I'm here representing the Disability Employee Resource Group. I actually came into the federal government just under 10 years ago via the Schedule A hiring authority. This is a tool that is used to increase employment opportunities for people with disabilities within the federal government. You can definitely Google Schedule A, and I know that the OPM website has a lot more information. I really like to advocate for it because it's not as well known as I think it should be, unfortunately. But I actually was a career switcher. So I spent 10 years in the private sector, actually working in graphic design for very, very small companies. My first company, I was the 3rd out of 3 employees. So coming into the federal government was a big adjustment for me, having, thousands of coworkers just within CMS, and then, so many within HHS and the rest of the federal government. Where I work now, I'm a full-time telework employee, and most of my coworkers also work from home. A few of them, I think, are opting to come into the office maybe once or twice a week. But I've actually never met my current team in person. But we have Zoom meetings. We have a really robust Slack channel. I have weekly meetings with my 2 managers, and it's great. We talk about business, but we also talk about, our pets and our families and vacations that people have gone on and things like that. I actually have 3 pet bunnies. And just today, my coworker, we were talking about a work project, and she was asking me how my bunnies are doing. So I was able to put in the Slack channel some photos of them, getting into trouble around the house. So it's definitely a positive work environment, and I think sort of the fact that it's a big agency, can be daunting, but also there are a lot of opportunities, both for meeting people and finding, a resource group or, someone to have lunch with, or, finding other, career opportunities or even just people to learn from. Everyone has their own sort of specific subject area that they're usually willing, to share what they know with people, which is really great. You can definitely learn a lot.
Good afternoon. I'm Lieutenant Commander Julia Zuko. I started in CMS in 2010 in what is now the Innovation Center. I converted to the U.S. Public Health Service in 2012, hence the uniform, and I am currently on deployment supporting our PHS headquarters. I'm the Vice Chair of the Asian American, Native Hawaiian, and Pacific Islander Employee Resource Group, where we recently celebrated Asian Heritage Month and hosted a couple of panels on mental health and wellness with guest speakers from the White House, SAMHSA, and CMS leadership. We have a great ERG group. Haley mentioned some of the other ERG groups, and we have a close-knit community, and we openly discuss topics like promotion and leadership. We recently started a mentorship program to assist in career development. And I work at the Centers for Medicare for 5 years, but spent the rest of my CMS career at the Innovation Center, where I currently work on evaluating new care and delivery models. In terms of the work environment, I have a research background and went to the University of Maryland for a doctorate in epidemiology. So I'm very fortunate to work in an environment that fosters collegiality and sharing of resources and data. We work independently on projects, but we do come together as a group to streamline processes and openly discuss concepts that are applicable across projects, such as health equity and beneficiary experience. I have great managers, great colleagues who value work-life balance, and we have a lot of strong relationships that carry over outside the business environment.
Thank you so much, Julia, and thank you so much for your service and being here with us today. Hearing the different descriptions of the environments that you all are working in and the service that you all are doing in your respective organizations, from Office of Human Capital, to the Centers for Medicare and Medicaid Innovation, and actually being on deployment and still being able to join us today. Thank you so much. So we're going to jump right into the second question. What is the biggest adjustment for you when you started working for the agency? And I love this question because we have just what we were talking about in our culture definition for CMS. We have, Haley, you've been with the agency for a few years as a part of the Pathways program, all the way to Julia, who, has a 20 plus year experience with CMS. And Carly, you've been around for about 10 years, it sounds like. So we have a nice ratio of time spent at CMS. So we'll go ahead and get started with you, Haley, and then Carly, you can follow up on what was the biggest adjustment for you when you started working at the agency?
Wonderful. Thank you, Heather. As Heather mentioned, I came in as part of the Pathways program, the recent grad program specifically. So I completed my master's program in May of 2021, and then I onboarded at CMS in September. And so I'm most of the way through and about to do paperwork to convert to permanent position and continue my journey with CMS. I think one of the biggest obvious differences, given the pandemic especially, is teleworking was a huge adjustment for me. Thank goodness most of my master's program was already teleworking, but beforehand, my previous position, we were in person throughout the entirety of it. But as Carly mentioned, we have Zoom meetings, and I feel just as connected to all my employees, and everyone has gone really up to par, has shown that we are working incredible and reaching great milestones, even teleworking, if not doing better at this point. From what I've heard, there's a lot of collaboration, and there's a lot of different venues that we use to make that happen. Positive big changes that I've experienced is that my manager personally gives me the freedom to complete a project or run a program without being micromanaged. And so I have the ability to flex with my experiences and with my recent education and really explore different ways to improve CMS and improve ways that we can serve the American people. There's also a lot more diversity than my personal last position. So between 1965 and today, for instance, there's been 16 CMS administrators and 7, just under half, have been women, which was incredible for me to find out when I first came. The director and the deputy director of my office are women. 2 out of the 5 group directors in my office are women. And I don't have the stats in front of me today, but our workforce is also incredibly racially and ethnically diverse. I work with multiple individuals in leadership roles who are of gender or sexual minorities. And diversity of thought is also encouraged in all that we do.
Haley, I love that. And really quickly, probably before you get started, you really started at the agency, in that going into that maximum telework posture. And so it's really interesting to hear you express that you actually still feel like you're a part of a team and that you're able to engage. And I know, Carly, you mentioned that with the 3 bunnies and being able to share your photos of your family. And so I think that's really awesome. It definitely should be noted that CMS really does have that family environment. And just to make a point on your comments around telework, I would like to make a comment for our listeners here that CMS is now actually in a remote first mindset, and the majority of CMS positions are remote. So it may be an option if you are hired in the agency, and is at the discretion of the manager. So we are in a maximum telework posture, and it is possible if you get hired at the agency to telework. So Carly, I'm going to go ahead and let you have the floor now to answer number 2. Sorry about jumping in.
No, you're fine. So the biggest adjustment for me, I don't think I even said what part of CMS I currently work in, but I'm currently in the Center for Medicare on the Part C and D side. I work in the Medicare Drug and Health Plan Contract Administration Group in the Division of Policy Analysis and Planning. So right off the bat, a difference in the government versus the private sector is we have a lot of acronyms and incredibly wordy division titles. But, when you're looking for a job, definitely don't let that intimidate you, just sort of understand the org chart and how CMS is divided up, and then it will all hopefully start to make sense. But I've also never had trouble with asking any questions or clarification, if you're not sure what something means. We've all been in that boat. So, it's just a government thing. But I would say, especially from my perspective on the private sector side, CMS is really invested in their staff. So, I know there's a question in the chat about training. Anytime that we need any kind of additional skills or training, CMS will provide that. And usually if it's something that, enough staff need, that will even be brought in, within the CMS learning platform. So if you work in contracting, or the most recent training I took was around reg writing, they will either bring that training in and either, in the olden days, maybe we would have that in person, on site, or, now it's more likely to be virtual, or they will work out a situation where, you can go to a third-party provider and take that training. And the thing that was weird to me was, you get to do that, like CMS will cover the cost and also let you take that training on work time. Whereas a lot of times in the private sector, you're sort of expected to keep up with the skills, or, you kind of get the sense that you're very replaceable. They can always get another graphic designer, another coder, another, fill in the blank. And it's sort of up to you, to go back to school or, do continuing education in your free time. So kind of having that investment in me as an employee, as a member of the CMS team, was something that really struck me right away. And especially if, the mission changes, or right now, we have a lot of webinars about, health equity and diversity and inclusion and all these different kinds of topics. So even just this week, I got to attend one about, Native American, American Indian, and the two-spirit concept. So, that is just really cool that you have the opportunity to keep learning, and that, my employer supports that, and in most cases brings that to me directly.
Thank you. Thank you so much for that, Carly. So we're going to move on to our next question and just really kind of interjecting some federal hiring and CMS facts in here. So at CMS, our mission is to serve the public as a trusted partner and steward dedicated to advancing health equity, expanding coverage, and improving health outcomes. This question is for Julia, and I want to know, Julia, based off of your experience within CMS, what are some of the CMS values that you have experienced?
Thank you, Heather. So we are the largest health insurance provider in the country, if not among the largest in the world. We do strive to improve healthcare quality, access, and affordability while reducing the cost of care. And I do love working at the Innovation Center, where I get the opportunity to work on new models that work towards improving the quality and cost of care. It's a basic mission that is carried over from administration to administration. We also, with the current administration, focused heavily on health equity, which is a topic that's near and dear to my own personal interest, and is one of the reasons why I became involved in public health in the first place. We have a number of work groups that involve what do we know? What do we currently know about health equity? What do we currently need to learn more about health equity? And where do we go from here?
Thank you, Julia. And so it really sounds like you are having that one-on-one experience with understanding and researching and being completely involved in health equity from an innovation perspective. And so you're really having that experience within the agency. So that's awesome. So it sounds like, Julia, you are on deployment, working in CMMI when you're in the headquarters, in the Innovation Center. So the next question is something that's more on the personal level. It's all about work-life balance. And so this was a question I wanted to pose to you, Julia, and I'm kind of doubling back here because you're on deployment. So I think you could really speak to what your work-life balance experience has been at CMS, if you wouldn't mind sharing with us.
Sure. So I do have very supportive managers, colleagues, as I mentioned before. At the beginning of the pandemic, almost 3 years ago, I don't even know how long it's been, but it was stressful. It was very daunting to have all of a sudden to have 2 young children at home with me all day and trying to get work done at the same time. It was very disruptive, but management definitely supported it. The agency supported it, which is why they came out with, like Heather mentioned, we're at a very supportive telework, fully remote environment in most cases. So we do have a very good work-life balance. The managers understand that people are under a lot of different stressors and of competing interests. So my manager, she's been very supportive of my past few deployments. She was able to step in, take on my normal day-to-day responsibilities while I have been on deployment, which is wonderful. I know it's very challenging to have to take on 2 roles as a manager plus another project of an employee. So she was very gracious, and she has been very supportive of both my PHS career and my personal life.
Wonderful. Thank you for sharing your work-life balance experience at CMS. Carly, can you share with us, I think actually, let's see, who do I have up? I think we have one more work-life balance response. Carly, can you share with us what your work-life balance experience has been at CMS?
Yeah, and I think I've touched on a little bit of this just with some of my other backgrounds, so I'm going to try to keep it short. But, one thing about the private sector, we talked about this before, Heather, is I had such little vacation time and sick time. And, I come to the disability community because I have a incurable chronic illness, and I've had it since I was 13. So, you can't always know when you're going to have a bad day, when you're going to be in a flare. I go to a lot more medical appointments than, probably the average person. And so in my previous career, if I would get the flu one year, it would be like, well, I guess I can't, go on a Thanksgiving break to see my relatives back in the Midwest, which is a bummer. At the very least, it's a bummer. And, it didn't make me a more productive employee. Certainly, it led to a lot of stress, a lot of burnout, and then, probably going to work on days when I really should have been home, taking care of myself and recuperating. So immediately coming into the federal government, you have so much better, work-life balance in terms of vacation time, sick leave, some of the options that other people on the panel have talked about in terms of flexibility. So for me right now, I'm able to work a 9.5-hour day and then take every other Friday off. So, I can use that time to, go to appointments or get errands done, or, in the summer, maybe go to the beach, or sometimes I'll go to DC and go to a museum or do a hike or something that is usually too crowded on the weekends, so I can take advantage of that day off during the week. I can also choose my start time. We're given sort of a band of work hours, and so I'm able to start work pretty early in the morning, which in the winter, when it gets dark really early, that means that I can get off work and still have a little bit of daylight left to sort of enjoy some time outdoors, or, go get some personal stuff done. So for me, that's really great, because it really alleviates a lot of the headache and trouble that, if you have a set schedule and you're working every single day of the work week, you would have to take time off to go to a doctor's appointment, or if you have to go to the bank or some other sort of errand where they're just not open on the weekends. So that right off the bat has been such a help to me from like an accessibility standpoint, that for most of my time in the government, I actually haven't had to request any additional sort of accommodations for disability. And that has just been huge, because that's also not something that, I have to go through a whole big process to access. It's something that is open to, almost everybody right off the bat, which, no matter what you're using that time for, it's your choice to really, you feel more like a autonomous adult. You can kind of choose how you want to manage your time, which is just wonderful.
Wow, really great experience that you've had coming into the government, Carly, with, being Schedule A and the appointments and so forth, and feeling like you have that support. And I love this webinar. This is one of my favorites, because we have our employee resource groups here. And so you're really able to give, your firsthand experience about what it's like to be at CMS, and also a part of the ERG. And one of the really cool things, and I was going to say this about Julia, this is volunteer work. These are things that are outside of your, the position that you hold. So we thank you for your service there. And then also just kind of being able to share this moment. So we talked about work-life balance. And I love the fact that we have Haley, because Haley she is transitioning out of the Pathways program, which is our program for students and graduates that would like to get into the federal government and have graduated within 2 years. So definitely get on USA Jobs, find our jobs, and take a look at some of our Pathways positions. And so, Haley, this question, I'll pose it to you first. It's all about growth and career development as you're in the beginning stages of your career at CMS. And I'll have Julia follow up on the other end, just kind of telling us about, what does growth and career development look like for you at CMS?
Sure. So as Heather mentioned, again, I'm from the Pathways program as a recent grad. And so we are required to complete 40 hours of training within a year. PMS, Presidential Management Fellows, have 2 years, and they have a different set of requirements. I think interns under the Pathways programs have a different hours requirement as well. But we regularly meet with a mentor, and she helps me hone in different ways to grow within the agency or even beyond. And where all employees are encouraged to continually seek training through something called our learning management system, LMS, for skills ranging from brushing up on a Microsoft Excel to networking, writing SOPs, and they're so essential to me being able to perform better in the current programs that I'm running, projects that I'm working on teams with, and then growing professionally as well. And we have more opportunities to expand that perspective with the intra-agency rotation program going on detail, to work in another area of CMS for a few months. There's programs like the Aspiring Leaders Program to prepare employees for management roles and beyond. And the majority of our senior leaders that I've heard from working with them directly or from sitting in on a webinar with them say that the biggest asset to them reaching senior executive service, SES status, or gaining experience in the federal workforce in general includes diversity in your background and your experience. So that's understanding the agency from multiple points of view throughout your career. Cross connection within the agency is also essential. Creating those bonds across different offices and centers opens up additional opportunities, and it opens the door for collaboration across the board to create or improve initiatives. And a lot of teamwork in my own programs happens. And so it's very rare that I would work on a program or a project by myself. It's always having input, checks and balances with other people. Julia, do you want to expand on that?
Thanks, Haley. I've worked both in the private sector as well as academic environments prior to coming to CMS. So I had managers who are not very supportive of my career development. So it's a breath of fresh air coming to CMS. CMS has tons of resources and training opportunities through LMS. I'm currently in the Aspiring Leaders program that Haley mentioned. It's been a great learning and network experience. And my manager is particularly excellent at self-development of goals and meeting regularly throughout the year to discuss whether or not I'm meeting these goals. And having such career development is critical in ensuring job satisfaction and preventing stagnation. Also, I really value the importance of mentorship. Find someone within CMS or HHS or even in your life to help you develop goals and lead you through their experience. I have a CMS mentor as well as 2 through the Public Health Service, and I am also a mentor. And a mentor is someone who you can mesh well with or someone who you admire. It should be someone you respect and value their opinions. And you can learn a lot through mentorship from both being mentored as well as becoming a mentor.
Thank you so much, guys. It's amazing to hear the depth and breadth of you all's experiences with career development and growth at CMS from both spectrums. And Julia, I love what you said about being mentored and, being a mentor and vice versa, actually being mentored, having it happen on both ends. And it sounds like it has impacted your career and that you feel supported in that area. So thank you for that feedback. And so we're getting to the end of our questions here. I know I feel like it's kind of a fire. I'm just firing off all these questions. So we're kind of getting to the softer side of CMS. My question for you all next is to Carly and Haley. What makes you proud to work at the agency? Carly?
Yeah, so you see, we're very polite. We don't want to interrupt one another. So I did a little bit of research, so I have, numbers to quote, but, the reason why I wanted to work, for CMS was because I started sort of, I think the way a lot of people with chronic illness or disabilities start, in a to the disease specific, mostly fundraising based, organization, and did a lot of support groups and volunteering and, things like that, right? And then the more that I learned about sort of the larger healthcare system and just similarities with, people that have other chronic conditions, I have lots of friends that have type 1 diabetes, things like that. It's like I wanted to work at a larger scale, right? So in 2021, we had more than 26 million people who were enrolled in a Medicare Advantage plan. So that's a Part C. That covers just under half, so 42% of the total Medicare population, and $343 billion of total Medicare spending. So that's a huge population that, I have a small part in serving, right? And, one of the reasons I wanted to get into policy work is because it's something that, is very important, you notice when it doesn't work. It's like a traffic light or something, if the traffic lights are working well, everyone's just driving on their way and they're happy and you don't think twice about it. But if the traffic lights are ill-timed, then you're in gridlock and everyone's mad and you're not getting where you need to go on time, And so, sure, it can be kind of nerdy and kind of wonky. And, we have some very specific subject matter areas, but, what inspires me to get out of bed every day is knowing that, we are helping people get access to healthcare. And, I have seen in my own life how important that is. And I have actually been in a situation where I had to choose between accessing my medication or paying my mortgage. And I had to choose my medication and I lost my home, So there's so many stories of people who work really hard and, take a lot of effort to keep themselves healthy. And I think that it's important that, we at CMS can support them and support the, physicians and the providers and, the healthcare systems that provide these services and keep people healthy and, let them live their lives. So I feel very, very proud to work for an organization that, our mission is to help people.
A lot of my answer is going to echo what Carly already stated. I'm also just really proud to be part of an organization that's doing incredibly important work. And as I mentioned before, I'm in operations under the Office of Human Capital, Division of Wellness and Engagement. And so what I do as part of my job day to day is supporting the employees who are supporting the rest of the US. And a lot of those programs are, they range from services that connect people through lunch and learns, through healthcare, employee assistance programs, et cetera. But overall for CMS, I think it has a huge impact on the healthcare in the US. And I feel proud to be part of such an important agency, serving people through initiatives that look to narrow health disparities and cover the healthcare needs of all individuals, as Carly was stating from her own personal experiences. And to give you an idea of how large of an operation the agency is, I'll echo an additional few stats. So CMS impacts 1 out of 3 Americans. About 22% of the nation's healthcare dollar goes to Medicare. About 16% goes to Medicaid. 83 million people are enrolled in Medicaid and CHIP, of which 9 million are children enrolled in CHIP. And about 64 million are enrolled in Medicare. So in total, that is upwards of 150 million individuals that CMS serves. And that's huge. Our work is incredibly important. And that means that we need to bring our best selves to the table each and every day. And that includes collaborating with others who may have a different opinion in order to come together and create the best programs and follow through the best initiatives possible with new innovation day to day, not just year to year. And beyond that, I feel like I'm making a big difference by serving through CMS, even in my own role at the current position I'm in. And I'm proud that this agency embraces diversity, as I've echoed before, and encourages personal and professional growth.
Thank you, Haley and Carly. And so if you're not convinced at this point, CMS really is an amazing place to work. And I think all of our sentiments echo that. We love the fact that we're having an opportunity to have an impact on the lives. And specifically at CMS, it's the lives of over 145 people. So that's including senior citizens, families, people with limited incomes, and people with disabilities. And I don't know if I mentioned this before, we manage programs and write the policy for programs like Medicare, Medicaid, Medicaid, the Children's Health Insurance Program, the Federal Health Insurance Exchanges, and the Affordable Care Act. So you heard me in the beginning, and I did want to chime in on this part. What makes me proud to work at CMS? And I was literally just having this conversation with another recruitment and outreach member. It's really having the impact on students, graduates, and job seekers to help them. I love being able to help demystify the federal application process and help individuals find their place at the Centers for Medicare and Medicaid Services. So we've been hitting on a couple of different topics, and I just want to jump in and just give some more information. We've been sharing a lot of data about our agency. So CMS, we are the largest purchaser of healthcare in the world. And as you guys have heard, we're responsible for one of our nation's most critical functions. So we talked a little bit about how CMS is in a maximum telework posture, and that is a possibility if you were to apply and to actually accept a position at CMS, and it's based off of the discretion of the manager. However, our state-of-the-art headquarters is located in Baltimore, Maryland. In Woodlawn, Maryland, right outside of Baltimore, and we do have 10 regional offices around the United States. So we hire. One of the things that I love about CMS and about being a recruiter is being able to burst the myth that CMS only hires healthcare professionals, because it is the furthest from the truth. As you can hear, we have offices and centers at our agency. Our centers are really where our programs are managed and policy is written and so forth. But our offices are there to support the staff work, to support the program. So Haley and I, we work in the Office of Human Capital, and our role is really to support our internal customer, which is CMS employees. So with that being said, we hire health administration and policy. Yes, our number one position that we hire at the agency is the health insurance specialist, followed by the social science research analyst. But we also hire in media and communication. So that's public affairs specialist, health communication specialist, visual information specialist. We hire the business, finance, and program support area. So contract specialists, accountants, auditors, financial management specialists, budget analysts, and also in the technology, mathematics, and science area. So IT specialists, actuaries, statisticians, and most recently, data scientists is a very popular position that we hire. So as you can hear, we get the opportunity to have an impact on all professional backgrounds. And our goal is really to help you have an interest in applying to CMS position and take the action to going to USA Jobs and actually applying. So I'm trying to stop with all of the recruitment and outreach talk, because this is all about CMS Culture Defined, but I definitely want to give you more information about CMS positions and just more about where we're located, what our agency is like, who we hire. So our final question today for our panelists, we're coming up at the end here, is for all three of our panelists today. And it's coming out of that softer side and kind of going back into your specific offices or centers. We know that you all are from our employee resource groups at the agency. You have your respective positions, and you're a part of an office or center within the agency. Can you talk a little bit about why it's important for our job seekers that are on the line listening to understand the programs or the models that you work in, or that your agency oversees? Why is your office or center, the work of your office or center, important? And we'll start with you, Haley.
Great. So to echo a lot of what Heather said, we both work in OHC, and so we're echoing a lot of sentiments along the lines of supporting the employees who are supporting the rest of America. And a lot of programs within Division of Wellness and Engagement include, for instance, I oversee the Brown Bag Luncheons Initiative, which allows senior leaders to really stay in touch with employees from all different levels, all different backgrounds, and figure out what's working, what can we improve, what do they like about CMS, what would be important to focus on. We also have the Burn Along program, which is a free resource for all employees, and they can take part in meditation sessions and exercise and financial planning and all these different assets that, as Carly mentioned earlier, can be done during your work hours. It's also highly encouraged. We have Wellness Wednesdays. We have day-long events once a month through Burn Along, which is fantastic. We have recognition programs through the Administrative Thank You Initiative. We have EAP, Employee Assistance Resources, where you have free access to a counselor to be supported in your work, in your personal life. Someone's there for you. It's completely anonymous. Your manager doesn't have to know. It's not reflected on you in any way, shape, or form. We have Work Life for You programs. We have all these different things that are important to CMS, perhaps not obviously from the outlook of, are we helping contribute to healthcare coverage of the American people? But we are there to support the employees in their day-to-day operations to bring them their best selves to the table. Julie or Carly, do you want to go next?
I can go. I'm actually having a Twitter conversation with one of the participants in this webinar right now. So like just an example, the disability community is great, and I've learned so much from other people, and I'm really grateful to be able to like share and give back to people. So anybody who's considering applying to work at CMS, I mean, please do, especially if you come from an underrepresented group, because there's so much that you can bring to the organization and help other beneficiaries. Absolutely. But anyway, so the question at hand, I never really explained too much about my current role, and part of my job right now, in addition to I am coordinating a regulation that the Part C and D team is working on that will come out in 2024. So that's just an example of kind of how long that process takes. But the other part of my job is answering questions, both from health plans and providers, to kind of clear up any confusion they might have about the existing CMS regulations and requirements. So sometimes what that means is just a plan is not sure what they're responsible for covering or not, and they would like us to clarify the people in my team are divided up by different subject matter expertise areas. And I think for people on the outside, it might sound really intimidating. I actually don't have a master's in public health. I don't have a clinical background aside from, my experience as a patient. And so, you can kind of get that imposter syndrome sort of situation. I think especially this might be, relevant for women, right? We might feel that more often. And I actually asked my boss about this, like what is important for job seekers to understand? And we had a little bit of conversation about it. We decided that, it's not that you have to be an expert in the subject matter. Most people are not, Medicare Part C experts before they come in. You need to be able to learn. You need to be willing to learn and able to learn. And it helps if you can work independently and as part of a team. A lot of the work that I'm doing is researching regulation, taking a stab at what I think the answer might be, or looking up citations, and then collaborating with my team and saying, oh, so-and-so, you've worked here 30 years, how have you answered this question in the past? What are some things to be aware of? What is the current administration like looking to highlight, or, what are some concerns we've seen in the past? But then, the underlying all the work we do, and I think, the other panelists will agree, is, if you have a connection or an interest in the mission of CMS, and, you have a heart for public service, I think, that's going to be key. You can always learn a different subject area. I certainly have learned many in the past 10 years here, but, I come to work and I'm interested to learn. I'm curious, I want to know, why do we do things that way? How could we do them differently? I love hearing from beneficiaries and understanding, what it's like for providers. How can we make the program more sustainable and better serve people in the future? So I think, if you are already coming to this webinar, you probably have some interest in CMS. So I think that's absolutely the first step.
Thanks, Carly. So as Carly mentioned previously, there are a large number of beneficiaries enrolled in the Medicare Advantage plans. The current fee-for-service model is not sustainable, both from an economic and quality perspective. CMS has developed several ways to reduce costs and improve quality, and many of these ways were developed through the Innovation Center. Working at the Innovation Center, you get a firsthand perspective of how care and payment are being revolutionized. I'm specifically working on the Maryland total cost of care model, which holds an entire state at risk for the care of its Medicare beneficiaries. And this program has actually drawn international recognition, with countries meeting with Maryland officials to learn more about the program.
Right. Well, thank you so much for sharing with us about your respective organizations, OHC, CM, Centers for Medicare and Medicaid Services, Office of Human Capital, and the Centers for Medicare and Medicaid Innovation. All of those acronyms that Carly was talking about, getting us all tongue-tied. That is one of the things that definitely I would say was something that I wasn't expecting coming into the federal government from private industry was acronyms. So definitely being willing to learn those things, right? So it looks like to our panelists, we are at the conclusion of our panel, our questions. Thank you so much for joining us, to our panelists, sharing your candid experiences at CMS with our audience. And hopefully there was something that was said, a nugget, a gem today that will inspire you to go and apply to CMS positions on usajobs.gov. So we do have one question in our Q&A. I know, Carly, you had a few direct questions. Thank you so much for answering. And thank you so much to Nicole Dean and Sean Forbes, who are my colleagues in the Office of Human Capital. If it weren't for them, they are our SMEs, our HR SMEs. And so thank you for answering questions during this presentation. So to the panelists, did you find the process of being hired at CMS hard? Did it take multiple applications to be hired? So you guys can just answer that, whoever would like to answer.
I can go first. So I have a funny story of my hiring process. So overall, the process, essentially, I think it might have been Sean actually reached out to me through Handshake, through our university's sort of LinkedIn equivalent. I heard about the announcement for the Pathways program. I applied through USA Jobs. And then a few months afterwards, I ended up getting an email asking if I wanted an interview, and I ended up interviewing with both CSIO and then with OHC as well. And then my interview actually took place while because it was virtual, I was in my car using Zoom on my phone, trying to look as put together as possible. And I was so stressed about the whole process, as I know that many of you are, about any job application, especially with the federal government, because I'd never worked federal before. And Ken, my current manager, really sold it. He had one of my teammates come on the call as well. I had 2 different interviews with them, and they were just so nice and so welcoming. And I knew from that instant, just from the interview, that it was going to be an incredible work environment, and they really are going to value me as a person, and I could work with them on a personal level and really work together. And so I think the hiring process for me went a lot easier than I thought it was going to. I mean, we had the basics of putting together your resume and getting your fingerprints done and the background check, but I think that if you're looking to apply to CMS, you can put a lot of your worries aside and know that it's going to go a lot more simply and easier than you may expect.
I love that, Haley, because first of all, my colleague Sean Forbes actually reached out to you on Handshake, it sounds like. Wow, what a story. I didn't know. So that's awesome. Shout out to Sean Forbes. We appreciate that. Thank you, Sean. We've got Haley on our team now. And so really that's a testament to the fact that recruiting works. Being in touch with employers it works. And so this is why these type of webinars are so important, and reaching out to us on our CMS careers page. And if you have any questions about, those worries that you said, resume writing and actually applying to CMS, you can always email us at cmsrecruitment@cms.hhs.gov. So thank you, Haley. Awesome story. Okay, so it sounds like you had a pretty easy process getting into CMS. I know, Carly, you came through the Schedule A process.
Yeah, so I want to, plug Schedule A, but there was a question in the Q&A. Somebody is saying that they're older, age 41, and it made me laugh because I am 41. And, one thing about CMS and, the government in general, but, CMS is we have people of all ages, all sizes, all backgrounds, everything. And, in my previous team, we had a woman who worked a full career as a nurse. And then once she retired from that job, she came over to CMS. And she was a great resource to our team. So, if you think you're too young or you're too old or whatever, you have to take the interview from your car, you're too casual, whatever, just try to throw all of those worries out of your head because, one thing about being an agency that serves, all parts of the U.S., it benefits us to have a diverse workforce. And, people's backgrounds and things that motivate them is only going to make CMS stronger. So, whatever sort of fear or awkwardness you might have, please apply. And I will say that, USA Jobs, the hiring platform, that's a government-wide platform and it has, a not great reputation, but there are resources. There are videos and books and there are, free things you can, look up online. In the DERG, we had a speaker come who did a presentation about the hiring process. And you really just have to learn how USA Jobs works and making sure that you are submitting what is required in terms of documents and that you are matching, the keywords. And, I encourage everybody to do a unique resume for each position. You have to put in the work. And once you get into the system, then usually you can be interviewed for multiple positions, especially within the Schedule A program. Once you make that hiring cert, other people might call you for other jobs that you didn't necessarily apply to. So it's worth putting in the time and effort and even just understanding, how USA Jobs works. And don't let your frustration, stop you from moving forward.
Thank you so much, Haley. And thank you so much, Carly, for responding to those, to the question about, your honest opinion about how your experience was getting into CMS. And so, like we mentioned, all of our positions are on USA Jobs, but reach out to us. We are a resource here to help you through the process. So we are bumping right up against time now. I'm going to go ahead and launch our poll. Let us know how we did today by responding to our poll. And so going to check the Q&A to see if I see one more question here. If there are any more questions, it looks like we're all closed out with our questions. Thank you so much, Heidi, Nicole, Sean, and Marla for joining us today, and Ashley helping with the questions. And so definitely want to remind you all that everyone who pre-registered will be receiving a follow-up email. Also, we will be posting these videos to YouTube. Also, do not forget, big reminder, we have the 4th of July holiday coming up, but that doesn't mean our webinar series stops. We're still here every first and third Wednesdays. Next up is July 6th, and we're going to do a CMS career spotlight on Office of Program Operations and Local Engagement, so our regional offices, and Centers for Program Integrity. So that's July 6th. So thank you guys for joining us. We're right here at 2:00, and we'll see you next time. Have a good one. Bye-bye.